In this lecture, I will discuss how to bring a stroke patient from a sitting to a standing position. There are several steps to follow. First one is to check a patient's posture. There should be extension at the trunk, head and shoulder should be at the level, and both feet should be at 6 inches apart, and there should be a flexion at the hip and the knee. There are two phases. First one is a pre-extension phase, other one is an extension phase. First, discuss what is the pre-extension phase. What happens in the pre-extension phase is first to bring a patient at the edge of a table to the brick walk. After coming at the edge of a table, start from the unaffected side. Like for example, if left side of her brain has a stroke, then in body right side of the body will be paralyzed. So start from the left side of a body that is unaffected, so that there will be interior translation on the knee. So first bring the foot of the unaffected side on the floor. There will be an interior translation on the knee, that is the unaffected knee, plus there will be slightly flexion at the hip. Then come towards the affected side, that is the right side in this case, and place the foot of the right side on the floor. Plus keep hand of the patient's right hand of a patient on your shoulder to give a support, and then hold the patient from the trunk and bring a patient in a standing position. Now patient is moving towards the extension phase. So what happens in the extension phase, that there will be extension on the knee plus slightly flexion on the hip plus interior pelvic tilt. Then command the patient to bring the affected side foot level with the unaffected side, so that the both feet are level with each other. Now patient is in the upright position, and there will be a 6 inches gap between the foot. What happens next is that the patient will be now in the standing position, and at the same time give support to the patient. Keep hand at the patient's shoulder, and head and a shoulder should be at the level. There's an interior pelvic tilt, and there's an extension at the trunk as well. These are all the steps so that how you bring a patient, stroke patient, from a sitting to a standing position. Next is essential components of a standing. Now, how you maintain a standing balance. There are several tests to perform. So how you check a balance of a stroke patient in a standing position. So in this, you will check the standing and a balance. In balance, we will check the body position, and another we will check the coordination. So we will perform different tests for the coordination. First one is the static balance. So what happens in the static balance is to check a rhombic test. In rhombic test, you ask the patient to close the eyes for 30 seconds. Three things combine to perform the coordinations. First one is somatosensory, another is a vision, and third one is the vestibular. So when eyes are open, all of them work together to maintain your balance. But when your eyes are closed, vision is excluded. So now whole pressure is on now the vestibular and a somatosensory system. So patient will close the eyes for 30 seconds, and this way you check a balance. That is a rhombic test. Another is a dynamic balance. So how you check a dynamic balance is the same as in the previous lecture. Internal perturbation, external perturbation. So what happened in the internal perturbation is that you check a balance, like to check whether a stroke patient sway or not. It can be performed alone by the therapist, or while the therapist perform, another another person can support as well. So for example, you ask a patient to abduct the shoulder and wait for 30 minutes and check whether a patient sway or not. Not just to abduct the shoulder, you can perform any other movement, just like mentioned here, like look up and down, look right side, then look left side, then look cross, then perform the forward reach. But every movement will be maintained for 30 seconds. Like if patient has a left side stroke, left part of the brain is affected, then the right weakness in the body occurs. So first perform on the right side to check out whether a patient sway or not. Then perform again on the unaffected side, same as perform on the affected. After the internal perturbation, next is the external perturbation. To make more complex, to give challenge to your balance, we perform the external perturbation. What happens in the external perturbation is to give a jerk to a patient. Start from the affected side, give slight jerk from forward, backward, and then the sideways. But at the same time, give support if in if in case a patient sway. Another is a standing balance. There are several steps that how you check a balance of a stroke patient. There are different tests to perform. First one is a one leg weight bearing. What happens in the one leg weight bearing? You ask a patient to stand on one leg. Patient will stand on both the leg, affected and the unaffected. First perform on the affected, then on the unaffected side. Then observe patient. The patient can maintain the balance or not. Another is a finger to nose test, same as the discussed in the previous lecture. So that how you perform a finger to nose test is command the patient to touch the tip of the examiner's index finger and then back to his nose and repeat that several times and then slowly increase the distance, then change the position. Then the examiners move some laterally and then again perform the same and then again give the same command and the patient perform again and slowly increase the distance as well. Another is a forward reach test. What happened in the forward reach test? There are two parts: forward reach test, and another is a cross forward reach test. So first give command to the patient to touch the hand and then slowly increase the distance, then move more laterally, which is known as a cross forward reach test, and then again give the command to touch the hand and then again slowly increase the distance. Last one is a forward stepping and a backward stepping. So in this case you ask the patient to take a step. So how the patient will take a step is that patient will be standing in a railing, between the railing, and keep one hand on the railing and take one step forward and then take the next step. At the same time you have to give support as well in case of if a patient fall. Then keep other hand on the railing and take another step and repeat again and again. Keep one hand, then perform a step, then again keep another hand on a railing and again perform a step, then repeat again and again. This is how you check a forward stepping and then a backward stepping.